people. Thank you both so much for being here. Picture a full classroom, like the ones we sit at every day in PCC. The seats are crowded and close together. There's not a lot of fresh air flow through the class. The teacher is giving a lecture, and in the back of the classroom, somebody coughs. Someone nearby breathes in. They may or may not be vaccinated. Maybe they have an immune condition. Maybe they're perfectly healthy. But breathing in this aerosolized virus could be the moment that changes the course of their life forever. Unbeknownst to them, a stranger's small cough or silent breath could be the start of a long-term health crisis or a disabling event that alters the course of their life. Now imagine we're all sitting in the same classroom, but everybody's masked. There is a low hum from the air purifier in the corner, and that threat is almost completely gone. This is such an easy way to care for community. I myself have a chronic illness that makes contracting COVID-19 a significant risk to my health. The singular time I caught it in 2023 altered my life forever. I lost my job. Because I lost my job, I lost my housing. Because I lost my housing, I was put in a very vulnerable position while experiencing the worst health crisis I've ever been through. Continuing community masking, especially indoors and in crowded, high-risk settings, remains a critical public health measure. Today, I want to talk about 3 ways that masking can make a big difference. First, it protects individuals, yourself and others, from illness. Second, it can prevent long-term damage, cardiovascular or vascular damage to your immune system that can come from even a mild COVID infection. And third, it advances social justice and safeguards the health of vulnerable and disabled community members. Let's start with the individual benefits of masking. The International Journal of Environmental Research published a controlled laboratory study that showed high-quality masks reduce exposure to viral particles by over 90%. A well-fitting KN95 can reduce it up to 95%. That becomes an even higher number when there's two-way masking, meaning 2 people are both wearing masks. A 2022 Lancet review found that mask use is one of the most effective non-pharmaceutical interventions associated with a 19% reduction in transmission community-wide. That number gets even higher when folks are wearing well-fitting respirators. Now, I understand that masks were largely written off during the COVID-19 pandemic as not that effective. Much of that data is based on tests that were done early in the pandemic when a vast majority of the masks were either cloth or poorly fitted blue surgical masks. Those masks provide very little protection. However, the science says that surgical masks, or that KN95s and that well-fitting respirators can provide a significant amount of protection. We need to look at the current science. Now that we have discussed how masking protects individuals, let's talk about how it has a role in preventing long-term health damage. Masking prevents long-term health consequences, including cardiovascular and vascular complications that can come from even a mild infection. COVID infections significantly increase your risk of cardiovascular disease. A major Veterans Affairs cohort study showed that a 63% of increase of risk of heart attack followed in the 1 year after COVID infection, a 52% risk of stroke, and a 2 to 3% increase in blood clots, even if you are not hospitalized. So you may think that the virus is very mild. However, the damage that it has done to your body is not. Physicians treating long COVID report that reinfections compound risk. Cardiologist Dr. Zaid Al-Ali states that there is no zero risk COVID infection, and each reinfection adds significant incremental risk of long-term organ damage. So again, it may feel mild, but the damage is not. So with compounding damage with each COVID infection, the more times you get it, the more likely you are to develop long COVID, increase your risk for stroke, heart attack, and blood clots. I myself had a pulmonary embolism just this last summer, which may have been partially due to blood clotting issues that could have been caused by COVID. Finally, let's look at how masking contributes to social justice and community well-being. Community masking is an act of social responsibility that protects high-risk people and reduces societal harm. It also takes pressure off of the healthcare system. About 7% of Americans are immune compromised, but over 30% live with chronic conditions that can increase their risk for serious disease. That's a pretty wide swath of the population. Being disabled is also one of the only marginalized groups that you can join at any time. So it just takes one illness or injury to make you part of that community. Fighting for disability justice benefits everyone, because soon it might be you who needs protection. We don't need everyone to mask everywhere all the time. If we could just get people masking in public crowded spaces that are unavoidable for disabled populations, such as grocery stores, schools, and especially doctors' offices, this would make a major impact. An article from the Clinical Infectious Disease issue number 77 states, a retrospective 8-year analysis from COVID and pre-COVID found that infectious prevention measures such as masking correlated with a 44 to 53% reduction in hospitalized onset of flu and RSV. Having less very sick patients puts less of a strain on the healthcare system and keeps doctors available for those who really need the care. Disability rights advocate Alice Wong, who recently passed away, stated, "Without community masking, many disabled people are effectively barred from public life." Do you remember the pain and isolation of the quarantine portion of the COVID-19 pandemic? How lonely and sad you felt, taken away from your community. Now imagine you have had to face that isolation still to this day, 5 years from the onset of COVID. That is extremely painful, and that is the reality for many disabled people. So while I know it is hard to remember the collective trauma of the pandemic, and we would all like to forget and just go back to normal, masking is a means of collective care that allows all, not just some of the population, to return to public spaces by protecting our disabled community members. Masking is simple, effective, and proven. It remains a powerful tool that protects individuals, prevents lifelong disability, and upholds collective responsibility. By masking in high-risk settings, we safeguard not only ourselves, but our entire community, especially the most vulnerable among us. And what is more important than taking care of each other? Thank you.
Do you have any tips for those of us who can't mask or don't mask as often because we cannot breathe in the masks?
I think you would be considered one of the disabled people in the population who need other people to mask on your behalf. So disability activist Alice Wong, who I talked about, was unable to mask because she was on a breathing apparatus. And so that's why she really advocated for community and public masking, because then those who really genuinely can't do it are more protected.
Do you know of any community or free resources for well-fitting masks that someone could access?
Yeah, it's always a good idea to look into like the mask blocks. I know that now a lot of those things are becoming more defunded, but I do know Always Here Bookstore always has free masks and tests. There are other like local community resources that I'm sure you could probably find online, but yeah, thank you.